From Human Biological Institute. Welcome to yet another session of our scientific forum, Immunization Conclave. At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through our one of the kindest platform, Immunize with Pride. Immunize with Pride is an awareness initiative dedicated to educating the public about vaccine preventable diseases and the importance of the timely vaccination. This session features leading experts from across country who has insight on the key health topics, is the awareness and promote the overall well-being of society at large. Today, we are delighted to have a Dr. Divyank Pathak, Dr. Chandan Barman, and Dr. Satish Sharma with us to share their expert advice on catch-up vaccination in adolescent, bridge the immunization gap. I shall be sharing more about today's speaker in short while. For that moment, please allow me to a brief introduction of Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited. It was established in 1982. The National Dairy Development Board as one of its units and the later incorporated as a company in 1999. SBI was founded in 1998 when the Government of India requested IIL to produce a modern tissue culture rabies vaccine to phase out unsafe nerve tissue vaccine. Our first manufacturing facility was set up at Uti. The facility is one of its kind of in India and rolled out the country's first varicose rabies culture vaccine in the year 2000. Today we are leader in ARV in anti-rabies segment with presence in around 60 countries. SBI has launched several vaccines becomes the major player in human vaccine segment. SBI has been a key supplier of the people disease to the government of India under its universal immunization program. In yet another milestone, SBI introduced Havisure in 2024, India's first indigenous hepatitis A vaccine, aimed at providing the protection for both children and adults, with the vision of serving global healthcare by spread our vision to innovate, produce and market quality healthcare products and service to improve the extend lives. We are committed to providing the affordable, high quality products through the continuous technical innovation to meet our customer needs. As a market leader, we take a significant step towards reducing the plastic burden by 160 tons per annum through the introduction of eco-friendly packaging of our flagship brand Avera. As a part of our corporate social responsibility, we have adopted schools where I will provide the infrastructure support and the basic facilities and including the assistance with midday meal program. In association with NDDB through the gift milk program, hundreds of school-going children benefit from the daily milk nutrition. We have also donated an oxygen plant to the Telangana Institute of Medical Science and Research. These are just few highlights of the IL, and these are few highlights. For more information, please visit our website www.immun.com. Immunize with Pride is one of initiative which emphasizes the vaccination not only protection of individuals but also strengthens the community immunity. Welcome to our today's episode of Immunization Conclave, and this session is dedicated to highly significant topic catch-up vaccination in adolescent, bridge the immunization gap. And it's my privilege to introduce our panelists, Dr. Divyank Pathak, Dr. Chandan Barman, and Dr. Satish Sharma, leading pediatricians. And it's my pleasure to introduce Dr. Divyank Pathak, a highly respected pediatrician and the pediatric intensive from the Banaras with extensive experience of the pediatric critical care and child health care. He holds a MBBS and MD pediatrics, IFPCCM and DPPA and DPSM, and is the director and the senior consultant of the pediatric at Vatshalya Super Specialty Children Hospital, Banaras. His areas of expertise including the pediatric care, pulmonology and allergy, asthma and immunization. Welcome, Dr. Divyank Pathak. It's a privilege to you have with us today. It's my pleasure to introduce Dr. Chandan Barman, a distinguished pediatrician from the Nalbari, Assam, with 12 years of experience in child health, and he completed MBBS from Assam Medical College in 2014 and MD in pediatrics from the Guwahati Medical College in 2019. Dr. Barman is committed to delivering the evidence-based pediatric care with strong focus on preventive health care and child development and immunization. Welcome, Dr. Chandan Barman. It is a privilege to have you with us today. And we are honored to have Dr. Satish Sharma, a renowned pediatrician and the medical director and the senior consultant pediatrician in New Delhi, and he holds MBBS MD in pediatrics and FIAP and FIAMS and FIACM. And he has served in several national leadership positions with Indian Academic of Pediatrics. Dr. Satish Sharma is widely recognized for his contribution to the pediatric practice, medical education, infectious disease, and the immunization advocacy. Welcome, Dr. Satish Sharma. It's our privilege to have you with us today. So let's start our today's session. So welcome, doctor, once again, and sorry for a little bit technical glitch. And Dr. Chandan Barman also joined with us now.
Yes, hello everyone. Good
Good
evening.
evening, sir. Yes.
Good evening.
So we already introduced you, and we are going to start our today's session. Session in adults. Good evening, sir. To
Good
start our
evening. Good
today's
evening.
session. So as our today's topic is Dr. Ketchup vaccination in adolescents and bridging the immunization gap. Before going to start the session, my just first question is going to Dr. Divyank Pathak. Sir, could you please help the parents understand what is catch-up vaccination mean and why it is such important concept for adolescents?
Yeah. So it is a very basic thing. Much of most of the parents do miss vaccinations. And, to keep it that way and then catch the vaccination is basically what these things. So catch-up vaccination simply means giving vaccines that are missed or delayed or during infancy or in childhood. Many parents assume that if the vaccine is missed, the opportunity is lost. But it's not like that. If the vaccine is missed, then it can be covered. Most of the vaccines can be covered later also, and so need not to worry about that. So adolescence in is actually a very excellent opportunity as they are very outgoing. They travel, they get a lot of contact. So vaccination of adult is very important because at that point of time you need to have a proper immunity uh, for coming years as the more interaction in the society goes on. So it should be done very aggressively and timely, and if not done timely, we can catch them. Thank you.
So, sir, so thank you so much, sir. You elaborate in a properly to for our audience and all the things about the what are the catch-up vaccination. So the next is for the Dr. Chandan Adolescent with in an incomplete vaccination, urban uneducated families.
Yes. Can you repeat the question, please?
Sure, sir. So, sir, the
Ah,
thing is, why so many children arrive at adolescent with in incomplete record and in uneducated families?
yes. See, there are two main points actually. Whenever we issue the vaccination card, it is our duty to elaborate them that what kind of vaccines are most important, what kind of vaccines are optional, what kind of vaccines are given in government setup, so that in future they follow up with this record and we can vaccinate them mm, uh, as possible. And the second point is what they think. Most of the patient they think about the cost. Even in the urban, in educated families also, they think about the cost and they think whatever vaccines are given in government setup, those are free of cost and those can be given. But we cannot pay for the private vaccines. That's why maybe that may be the reason for incomplete vaccination even in urban setup.
Okay, so thank you so much, sir. You elaborate in proper way to our audience about the their to maintenance their the vaccination record. So the next is thing is to
Yeah. Hello. Am I audible? Am I audible?
yes, sir. You are
Hello.
audible, sir.
Okay.
Yes, sir. It's
Okay.
audible, sir.
The immunization gap in adolescent means either they have missed the vaccination at all, or the vaccine have been delayed, or they have forgotten to take the vaccine between the age of adolescent 10 to 18 year, 19 year of age. So both catch up of childhood vaccine and adolescent specific vaccine. So this is very important. And as a part of this gap, we have what is the gap, how much is the gap, okay, and what are the missed childhood vaccine which they have been not been given. Children who missed either MR, DPT booster, or typhoid during 5 to 10 years of age at that school, or no adolescent vaccine has been given like HPV for girls and boys, Tdap booster, hepatitis A, hepatitis B, typhoid vaccine, varicella, and meningococcal also. Or there is lack of awareness in the parents. पेरेंट थिंक वैक्सीनेशन तो 5 साल पे खत्म हो जाता है, उसके बाद कोई जरूरत नहीं है 5 साल के बाद. The school and the pediatrician don't remind them also. So we have a whole generation of entering childhood with a poor immunity into the adulthood. And this will have a long impact in the life if they have not been in adolescent period. For example, the risk of cancer risk, HPV vaccine, cervical cancer in girl or anogenital cancer in girl and boys, and this is 100% preventable cancer in the women, the cervical cancer by this vaccine preventable vaccine. This is the only cancer. Then chronic liver disease like hepatitis B, the risk of cirrhosis and cancer and about 20 to 30 years after that. Or hepatitis A. This has been seen now these days. Many cases of acute liver failure they are coming with hepatitis A. So loss of school and work and hospitalization. For example, if somebody has not taken Tdap, adolescent get whooping cough, they more prolonged. So he will be able to go to school. He may have anemia. Similarly, typhoid, meningococcal vaccine. So there are life-threatening infections out there. Then pregnancy complication. If the girls reaches productive age without rubella vaccine or immunity, they are risk of congenital rubella syndrome. And our government was very particular few years back. All over India, there was a campaign, MR campaign was there. So the childhood vaccine, they protect for childhood, but adolescent vaccine protect the adulthood. So we tell to the parent that if we miss this window period of 10 to 18 year adolescent vaccine, then best chance to prevent cancer, chronic liver disease, and the outbreak sometime in hostel and the adolescent. So we vaccinate children to save life today, and we vaccinate adolescent to save 20 years from today onward. So this should be our message to the parents that they are also very, very important for our life. Thank you very much.
Thank you so much, sir, to elaborate all the things of the immunization gap. So the next thing is, sir, to Dr. Divyank Pathak. Sir, hepatitis A and hepatitis B are among most commonly missed vaccine in adolescent. So could you explain why catch-up vaccine for both is so important at this stage of life?
Yeah, as Dr. Satish have already covered this, like why hepatitis A and hepatitis B is important to us. But I'll go through in a very short manner that hepatitis B is a lifelong disease, and that can lead to liver cirrhosis afterwards and liver cancer. And infection acquired can remain dormant and then can activate afterwards also. And it is acquired in the childhood, and then afterward there are higher chances of getting chronic. So that's why hepatitis B have to be dealt with. And coming to hepatitis A, in comparison to hepatitis B, hepatitis A is slightly milder, but it have we have seen a lot of cases in which the children have been went to liver transplantation or liver failure. So there are a lot of cases getting to more of complications with hepatitis A, not only liver transplant or these things, hemolytic और मतलब blood टूटना और ये सारी problems भी बहुत सारी देखी जाती हैं. So sometimes these cause prolonged illness, and obviously we don't want these diseases because this can spread easily through contact and contamination. This hepatitis A, and we can prevent that very easily by getting vaccination. So both vaccines are safe, and it is highly effective when given. And as hepatitis B is mostly covered in government schedule, so most of the parents do automatically get hepatitis B, but hepatitis A is not covered into government schedule, so that the parents have to be educated that hepatitis A you have to ask your pediatrician to give or to take hepatitis A for the child to secure a better future for him, because it can cause a lot of illnesses and then you suffer. Thank you.
So, doctor, as you both mentioned that the catch-up vaccination is most important thing. So, if a person miss the vaccination in the childhood, so is there any separate special schedule is there for them to take that vaccine, or is it the same thing they need to visit with a pediatrician and consult and took that vaccine at the same time?
Should I answer?
My thing is, sir, if any person is not taking any kind of vaccine in their childhood, like for hepatitis A or hepatitis B vaccine, they miss in their childhood. So, is there any separate schedule is for them? They can just visit near the pediatrician as per their consultation. They can take the vaccine in their adolescent age also.
See, obviously, whenever if they have not taken the vaccines, they cannot go and just take the vaccine by themselves. You have to go and ask your pediatricians. As per se, there's no specific guidelines and schedule specifically for missed vaccinations, but we have things when to give and when not to give. Most of the vaccines are mostly covered for lifelong. We can give at any stage of life. Mostly in adolescence we can give, especially for but for giving for hepatitis A and B, I can say that in hepatitis B, obviously there is a schedule which we have to follow initially, and for hepatitis A, one dose of live vaccines or two doses of inactivated vaccines can be given. But if missed, then you can already any time you can catch up with the hepatitis A or B vaccine. You can give. Just you have to consult with your pediatrician. You have to see whether uh, what is your antibody titers. If you are very late, if you may catch automatic immunity also if you have suffered with these diseases. But yes, you have to consult your pediatrician and then you have to go for the vaccination.
Sure. Thank you
I
so much,
think
sir.
one
For,
thing, sir, one
yes, sir.
thing, because sometimes the parents they are not aware, so we have to ask about whether he has received any vaccination. Patient says, "Sir, एक तो मुझे लगे थे." So you don't have to start from the very beginning. Hepatitis B, you just complete. If he has taken one dose, give two doses. If he has taken two doses, you give three doses. The third dose, hepatitis B. Similarly, if some adolescent come and he has not received any hepatitis B, you have to give him or her three doses. 0 month, after 1 month, and after 6 months. So you have to complete the schedule. Similarly, if hepatitis A vaccine, if somebody has received, let us say, one vaccine, schedule is to give second dose after 6 months. But you say, I have taken 3 years back, can't forget to take second dose. So don't start with the first dose, give him second dose. So this should be true. So give him second dose. If he has not taken at all, then you give hepatitis A 6 months apart, two doses.
Yeah, but the ultimate thing is you have to discuss it with your pediatrician.
Yeah, yeah.
So much, sir. You completely elaborate in proper way to for the audience. Uh, so followed by the same thing, sir. The thing is the question is for the Dr. Satish Sharma. For families who are taken hepatitis A or hepatitis B vaccine earlier, should they verify the records? And if they are unsure about the hepatitis A or B vaccine they took previously,
So again, this is a very common scenario in our practice. And even I think 50-60% of the patient in our practice they come. और पेरेंट सर पता नहीं लगा या नहीं लगा, पता नहीं लगा या नहीं लगा, उनको याद नहीं है. So we have asked them to bring what I say. You show me your vaccination card. Sir, हमारा तो गवर्नमेंट में लगा था. Okay, show me your government card. That is called Model Child Protection (MCP) card. Okay, because now these days government has made it mandatory. Any child is born whether in government hospital or in a private nursing home or a hospital, before patient discharge, he has to get hepatitis B, OPV, and BCG. So from now it is compulsory. Earlier, so patient से 3 डोज लगी नहीं लगी, 2 लगी कि नहीं लगी. So if no record available, if you want to do a blood test, anti-hepatitis B titer, you can do it. If the level they are more than 10 ml international unit per ml, then it means the child is protected, no doubt of giving. But here, the question is, Giving hepatitis B vaccine is cheaper, just 50 rupees, and giving a test is more. So even there are WHO guidelines are there, IP guidelines are there, and American MBBS CDC also says that giving one extra dose, two extra dose doesn't harm the child. So better to give one dose if they are not. It is 100% safe to give this vaccine. So similarly, about I have told you about the hepatitis A also. Some children they don't forget and they are going to hostel particularly, and they ask, sir, hepatitis A lagwana hai. So should we go for the title? Because it is in the some are going for master degree abroad, in many universities abroad, and there is one column, MMR, either measles this title or vaccination proof is there. So I tell them, why I want to go for this title? It is safe vaccine, it is cheaper vaccine, better you get hepatitis. So it means they are safer. If the history they are not sure, they are not confirmed, they don't remember, we can give extra dose of this. This is it.
Okay, so thank you so much, sir. So,
Hello.
sir, followed by this question, the next question is for the Dr. Divyank Pathak. What are the most commonly missed vaccines by the
Your voice is breaking right now.
is it clear, sir?
Yes,
Yeah.
yes, yes.
Yes. Yes.
Thank you. Thank you, sir. Thank you so much. Followed by that, sir, the next question is for the Dr. Divyank Pathak. What are the most commonly missed parents adolescent and why do these gaps happen?
See, first of all, I'll just mention what are the vaccines which usually they miss. So, and then I'll explain why. So, it is hepatitis A, booster hepatitis B, HPV vaccines, Tdap boosters, influenza, typhoid, varicella, MMR booster, and meningococcal and Japanese encephalitis. So I am saying this because these are the list. This is a list, but there is a specific reason because generally the parents have a tendency to vaccinate till 5 years of age because these recurrent follow-ups are there and everything. After 5 years, their follow-ups become very less, and the child also generally we are seeing that child gets less sick after 5 years of age. So that's why there is less visits to pediatricians and less vaccines are there after 5 years. So I generally tell parents that divide your vaccination as understand your vaccination before 5 years and after 5 years and adolescence. So because after 5 years you have to receive certain set of vaccinations every yearly. Can be influenza also. There can be then 8 years or 9 years 10 years Tdap boosters and then HPV vaccines, or if earlier many vaccines are left, then they can catch up. So divide it into below 5 years and above 5 years. But yes, there are many reasons, and most of the definitive reason is that around 5 to 6 vaccines are not covered by a government vaccination schedule, and most of the parents are not aware that these vaccines are also there. And because most of the population go to government vaccination because it's free and it's a very good initiative. But yes, because of loss of knowledge or lack of knowledge, they don't know. But you should always ask, always, whether you are vaccinated in private or government, you should always ask your pediatrician and show your card and whether all vaccinations are given or not. In many private setups also, there are one or two vaccines which are not given or optional, and these things happen here and there. So always ask your pediatrician whether all vaccines are given or not.
you, sir, clear about this point. So the next thing is to Dr. Satish Sharma.
You're not audible.
Hello.
Hello.
Your voice is breaking. Your voice is always breaking in between.
Just give me.
So yes, while he joins, we can all, in general, also we can discuss these things. It is very simple that the simple thing is whether how do parents come to know what vaccinations should be given or not, and I think we always have a vaccination chart. Uh, the pediatrician always give a vaccination chart to the patient, and in government also they also give a vaccination chart that is national immunization schedule. So you should always see that chart, because many parents come to us and they say कि सर इसका वैक्सीनेशन करवाना है. तो जब हम लोग पूछते हैं कि लास्ट कब कराया था, तो when they see their vaccination card, then they know that कि अब तो एक बार मिस हो गया, दो बार मिस हो गया. दे डोंट सी दैट कि वैक्सीनेशन कार्ड में कब डेट आ रही है, कब डेट नहीं आ रही है. सो दीज थिंग्स आर वेरी कॉमन थिंग्स. Just you have to ensure one thing: if you have a government vaccination card, so there are a few vaccines which are not mentioned in this, so you have to get into IAP updated vaccination schedule. You can type this IAP updated latest vaccination schedule on Google. There is a beautiful chart, and you can see all the vaccinations when you can give, what is the ages. So for parents, it become very easy to know uh, what vaccinations can be given, and obviously you have to discuss it with your pediatrician. Any question, anything, you have to discuss it with pediatrician. That solves the problem. And yes, you have to write latest one, because these guidelines keep on changing every 2 or 3 years. So many times the child who have received like a 10-year-old child who have received vaccination 10 years before the vaccination card was made. So now their vaccination card and today's vaccination card may differ. So there can be some vaccination added. Like right now, dengue vaccination is been introduced, so it will be applied in 1 or 2 days, 1 or 2 years. So the updated vaccination schedule, you should search for it, and through that also you can get, and always ask your pediatrician for it.
So for closing, Dr. Divyank has said, very rightly said. And when you have to catch up these children, this immunization gap is there. There are two things. One is there is role of school health checkup. Dr. Vinay, yes, you are here. Audible? Dr. Vinay, you are not audible, Dr. Vinay.
Am I audible now, sir?
Yeah, 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 yeah. I'm audible.
Thank you. Thank you so much, sir. Sorry, glitch, sir.
Yeah, yeah. So, hello. Yeah, please, Dr. Vinay.
Is it audible now, sir?
Yeah, yes, yeah, audible, audible. No, not audible now. Okay, okay, we'll discuss it. It's okay. So,
Okay, Dr. Vinay will take over
yeah,
it.
yeah.
Yeah,
Where
we'll
to?
just
Yeah, yeah. We'll
keep
move
on
forward.
talking and these things. We
We
move
will
on.
move forward. Now to close this gap, what we are discussing, adolescent gap, how we can do it. Like the Divyank said that most of the children they come to us below 5 years. Adolescent they come to very less in our OPD practice. So is there a role of school health? I will say yes. So two things are there: school health and the pediatrician. Both they have role. Or school health. School health can, because 80% of the adolescent we can find them in the school, and to our clinic they come only occasionally for cough, cold, fever, stomachache, and like that. Some sports certificate, some swimming certificate, so we can catch them at time. When they come for swimming certificate these days, okay, sports certificate these days, bring your card. Have you brought immunization card? Can you show me? Like that. So this is the miss. If we have missed this opportunity, it means we don't check the vaccine. Similarly, the school, there is big role of the school. School can do screening and record audit. Annual health checkup are being done in the school, and I have been medical officer in some of the school. They are just checking, teeth and the this height and weight and all this and hot. But we should emphasize on the immunization card, immunization, whether they have been given MR booster, HPV vaccine, Tdap or typhoid. Then awareness camp, one session per year for the adolescent. We should have awareness camp also. Sometimes they were a myth. Now the government is also having the camp, the HPV vaccination free in the school. 9 year plus girls giving free, but still the school tells me that and hospital telling me, sir, patient there still a certain myth about the HPV vaccination. So we pediatrician with the school, and if the school can have a vaccination drive, but with the prior consent permission of the parents, with the health authority, so that will remove the time plus access barrier, and we identify the high risk children by school health checkup, congenital heart disease, anemia, diabetes, like that. So they we tell their parent they are more prone to disease, infection, they require more vaccination. So that is the way that school and pediatrician we catch out of them, and the adolescent visit at 11 year, 16 year is mandatory. But make it mandatory, and you give them at them Tdap, HPV, and hepatitis A and B. So when in doubt, so vaccinate. Don't ask them, just the parents. So gap is closed only when both we work together, the school as well as we the pediatrician healthcare worker, and school find the gap and we clinic closes the gap. Because we are to person we are going to give the vaccine and school find it. So we need to shift the mindset of the parents that vaccine is only till 5 year. To the vaccine for we have to say vaccine is for life. The adolescent are going to enter into the adult life. So that's the immunization status should be checked in every school, and we should take the opportunity when they come to us with any minor ailment like cough and cold. Thank you. You are not audible, Dr. Vinay.
Okay, Dr. Vinay, you're totally not uh, audible. So,
So, thank you, Dr. Satish Sharma, to enlighten about the closing the immunity gap and simultaneously about the role of school and pediatrics. Followed by that, the next question is any is limit for the ketchup vaccine in their late safely teenage.
so, I guess I just heard few words. Any age limit, right? So, if the question is, if is there any age limit for any vaccination? If I'm guessing right, then or catch-up vaccinations. So obviously there is the answer is slightly complicated, but a simple one. Most of the vaccines have no age limit, but there are some vaccines which have. So I would not go into every vaccines and details because that is the work of your pediatrician to decide for you. I'll just name some vaccines which can be given generally all your life, like hepatitis A, hepatitis B, HPV vaccines mostly in females, uh, Tdap, or influenza, MMR, varicella. So these are vaccines which can be given, but and specifically in adolescents, you can catch up and easily you can give. But the main important point is that if you have not given or you have forgotten the vaccination, and or if it is too much delayed, then also like today only I was seeing a 14-year-old child came, and they said that the child have received vaccination till only 1.5 year age old. Okay, so I just said one line ki maybe vaccination will slightly work less, but it will work. Though it is not too late, always vaccinate your child. Don't think that it is too late now. It is the window is over. Don't decide by yourself. The point is, delayed vaccination is better than no vaccination. Okay, so obviously you have to discuss if there is any vaccination which cannot be given due to some illnesses or previous exposures or any allergies. But yes, there you have to go for vaccination. And the myth that the delayed vaccination should not be done and it is strictly prohibited to specific timeline, it is not like that. But the timeline, but after that, you have to just continue with it. If you are missing anything, missing the vaccinations, then you can discuss with your pediatrician and go for vaccination straight away, and don't worry about these things. So you will get the immunity well enough, and which will be enough to protect you from becoming any serious complications.
So thank you so much, doctor, to give us clarity about the teenage vaccination also. So the followed by the next question is for the Dr. Satish Sharma. Is there any special consideration for the adolescent with the chronic illness and low immunity or history of missed vaccination during the catch-up vaccinations?
Yes, for a normal, healthy teens or adolescent, catch up is a simple thing. Not Divyank has also discussed. But for special adolescent, we need three things. Number one, first we assess them, then we protect them, and then we prioritize this. For example, adolescent with chronic illness, I have told you, diabetes, asthma, skeletal heart disease, CKD or epilepsy or patient nephrotic syndrome on steroid or some other reason on is some cancer patient is also there. So all they need vaccine more. We have to tell the parents they need more, not less, because they are prone to infection. So all inactivated vaccine like Tdap, HPV, hepatitis A, hepatitis B, typhoid, pneumococcal influenza.
Uh,
Dr. Vinay,
thank you, Dr.
Immunocompromised cancer or chemotherapy, post transplant, or HIV patient, or on hard steroid, or biologicals also. So, inactivity, I have told you, inactivity vaccine safe to give, like HPV, hepatitis A, hepatitis B, kill typhoid. Live vaccine we avoid, like chickenpox, varicella, MMR, BCG, live typhoid, or and this all these things. Check with your oncologist, your pediatrician, that whether he can receive now patient is in on maintenance therapy or in acute therapy. But one thing is important here: you give Tdap and flu to the all family member of this cancer patient or immunocompromised, because that will form a form of cocoon. We call it cocooning around their child, will prevent the child from getting from their family member. So timing is very, very important. If either we start 2 weeks before the start of chemotherapy, or we have to wait till sometimes 3 months up to 6 months, depending upon case to case, after stopping chemotherapy or the treatment biological. So this we have to discuss with our the treating doctor, treating oncologist or hemat-oncologist, whatever nephrologist. So we have to discuss with him. So adolescent with history of missed doses, this is 90% catch-up cases are there. So our special consideration, no need to restart the series. Whatever dose they have taken, count them, just give remaining doses with the minimal interval. When in doubt, if no record, give them the from the medicine. So this is the take up in special situation. Yeah. Prioritize करो उनको and for normal teen follow up the IFP schedule as Dr. Divyank has told. Their IFP schedule is also there. For special teenage, individualize their prioritize them, but don't deny them. All the parent they need special, they need more vaccination. So missed in a vaccine in a chronic child, much higher risk than a vaccine side effect. So we have to sick children need vaccine most as compared to normal adolescent. So we have to tell to the parent. So assess the risk of the disease versus risk of the vaccine. Always choose the protection first. So this should be our message to the parents who are here and to our pediatrician colleague. Thank you.
So thank you, Dr. Satish Sharma, sir, to give us the complete clarity about the things. The followed by that, the next question is to Dr. Divyank Pathak. So, what common myths about the catch-up vaccination and such as things are there like it's too late now and extra dose is harmful. So, would you like to clear these all things to the parents?
Yeah. So there are many myths actually, but I'll just give a I'll make you understand through a scenario kind of thing. But like there are myths like it is getting, like as you said, it is getting too late. So earlier we have discussed, if it is getting too late, don't worry, we have catch-up vaccinations. You can do catch-up vaccinations. So delayed vaccine is better than no vaccine because it will give immunity, and rather than giving no vaccine. So it is nothing like it is too late. Okay. The other thing is vaccinations are harmful. Many people think of too much of vaccinations, too much of these things can harm the child or can create illnesses, but it is not like that. The vaccines which we are proposed have gone through too much of research, too much of trials, and those are very foolproof vaccines. So it has gone through all the hardships which we can make them face, and after that, these vaccines are approved for us, and so it is very safe whenever if it is uh, like recommended. So it is recommended with very responsible hands and minds that nobody should get affected adversely. So these vaccines are always safe, and it can sometime it can create allergic or anaphylactic reactions, but I have not seen anything in my life, and most of the doctors have not seen these things. It is just one case or out of nowhere. So that is the incidence. But the most important myth is that कि like क्या होता क्या है ना कि many people think कि सब nature is the best thing. Okay, so nature अगर है तो हम लोग को सब artificial क्यों करना है? There are many things. There are many people think कि everything can be done by natural processes also. So मेरा इसमें take ये है कि I can, if you are having a life coach और लाइफ मेंटर, लाइक कभी हमारा कोई स्पिरिचुअल गुरु है या कोई लाइफ कोच है, तो वो हमको क्या करते हैं, वो हम लोग को बताते हैं, सिखाते हैं और एक्सपीरियंस से बताते हैं कि ये हो सकता है, ये प्रॉब्लम होगी, तो आप ऐसा मत करना। तो उनसे हम सीखते हैं और एटलीस्ट हम अप्लाई करते हैं अपने लाइफ में। हम जस्ट रिमूव योर लाइफ कोच आउट ऑफ योर लाइफ सिनेरियो, तो क्या होगा, आप गलतियां करेंगे, आपको प्रॉब्लम होगी, चोट पहुंचेगी, दुख होगा, उसके बाद आप सीख जाएंगे। तो सेम हैपेंस विथ आर इम्यूनिटी ऑल्सो। अगर आप वैक्सीन नहीं लगाएंगे तो आपको क्या होगा, नेचुरली आपको इन्फेक्शन होगा, आप कॉम्प्लिकेशंस होंगी, आपको दिक्कत होगी, आप ट्रीट होगे, ठीक हो जाओगे, इम्यूनिटी को पता चल जाएगा कैसे लड़ना है। अगर यही चीज़ हम वैक्सीन पहले ही दे दें, इम्यूनिटी को पहले से ही पता रहेगा कि मुझे कैसे लड़ना है, विदाउट एनी कॉम्प्लिकेशन, विदाउट एनी सफरिंग। सो बेसिस यही है वैक्सीनेट करने का, कि हमारी इम्यूनिटी को पहले से ही बता दें कि इस डिजीज से पहले से लड़ना कैसे है, ताकि अगर आपको वो डिजीज आती है तो वो आपको परेशान ना करे। सो इसलिए जो मेजर मिथ ये होता है कि हम वैक्सीन क्यों लगाएं क्यों ना लगाएं, तो एक यही सेफ्टी होता है, और दूसरा होता है कि क्यों करने की ज़रूरत क्या है। तो सेफ्टी इज ऑलवेज सेफ, एंड करने की ज़रूरत इसलिए है ताकि आप पहले से ही तैयार रह सके कोई भी डिजीज़ के से, so that you should not land up in ICUs or serious complications by the diseases. And that's why these myths should be, I think, this is the basic myth. And small myths can be there here and there, but otherwise the nutshell is that you should vaccinate, there is no harm in it.
So thank you so much, sir. Give us a complete clarity and the example also, whatever you use by you, it's give us the complete picture to our audience and the parents. So followed by the to the is to Dr. Satish Sharma. If a parent is watching this program today, what is the first practical step in this week they need to take to complete their adult?
Parents, if you are watching this program today, you take away only one thing today, that 10 to 18 year is not the end of the vaccine, it is the start of the adult protection. Okay, this should be in mind. First, you go home after listening to this, find out the child card, his government card, when he was given in when he was 1.5 year newborn or whatever it is. Try to find out school health card. If card is not available, you are not able to trace. Don't become panic. Don't get disheartened. We are here to make new file, new card for you. Okay. Sometimes because they are lost. And if you find the card, go and check whether this vaccine, which told by the Divyank, the adolescent vaccine like Tdap or HPV vaccine, hepatitis A, B, and typhoid, all these has been entered in your child adolescent card or not. If card you have traced, but they are not entered, it means it has not been given. So better to take them now. So book appointment from tomorrow. Go to your pediatrician. सर मुझे अपॉइंटमेंट चाहिए, कि मेरे कार्ड में क्या कमी है, क्या ये सारे टीके आज लग जाएंगे, कब कब लगेंगे, आपने तो मुझे 5-6 टीके बताए हैं, मैं तो घबरा गई हूँ बहुत ज़्यादा। तो घबराने की जरूरत नहीं है, टीके सारे लग जाएंगे, इनको हम कैचअप बोलते हैं। और ये आपके बच्चे के आगे, बच्चे ने हॉस्टल में भी जाना और आगे है ना। और जो मैं बताता हूँ पेरेंट्स को, मेक ए डिजिटल रिकॉर्ड, मेरा जो इम्यूनेशन कार्ड है उसका फोटो खींचो, अपने व्हाट्सएप ग्रुप में डाल लो, एक इसका फोल्डर बना लो, इसका इम्यूनेशन, और अपने लैपटॉप पर डाल दो जितनी बार भी करो, ताकि आपका कभी भी गुम नहीं होगा। आपका बच्चा मास्टर करने जा रहा, जब 22 साल का होगा, 25 साल का होगा, बाहर जा रहा है, आप मेरे पास आओगे, सर मुझे सर्टिफिकेट बना दो, मैं आपका नहीं बना पाऊंगा, या कोई पीडियाट्रिशियन नहीं बना पाएगा अनलेस अनटिल आपके पास। तो अगर आप डाउट में हैं, नहीं मिला है, कम मिला है, go for it. So this is my final message, that you did all the vaccine till 5 years to protect them as a baby, and now do these vaccine at your adolescent to protect them as an adult, like cervical cancer, as Dr. Divyank said, lung cancer, liver failure, liver transplant, and like that. So don't wait for next year. This week is the right week. Go tomorrow to your pediatrician. Yeah.
And from
Sure,
my
sir.
side,
आपने बहुत अच्छा
I'll give you my final verdict. That already sir have told everything, but one thing that the main thing is, most of the parents have one thing, that most, because government is giving it free, so cost becomes a issue for many of the vaccines. So for that, I would like to say it is not a expense; it is an investment of on your child. And I have made a reel on that. Ki if you are purchasing an iPhone, latest iPhone, it is equal to the all the vaccinations of whole your life. It is equivalent to that cost of your iPhone. So it is just your perspective that it is very costly, but it's not. It save lives. If you don't we don't understand because you don't see those patients, but one who suffer, then they realizes what is the importance of that vaccine. And obviously, whenever if it's never too late, but every day delayed is a kind of uh, day without a protection. So every day with your guards down, you are moving around, anything can happen. If you have your guards up, you are safe. And nothing is everything you are doing, it is for your child. So if you can secure your if you can put gold coins and these things in your locker for your future generation, then before that you should invest in their health first, because if everybody will be healthy, then these gold coin will give us rewards afterwards. Otherwise, it's of no use.
Very, very nice counseling of parents, Dr. Pathak. Very nice
Thank
counseling.
you.
And how I do it, I say, now when you are wearing the branded shirt, we go to hotel restaurant, we don't ask for the how much is the bill, just we pay, even we pay the tip. Branded shoes. Then I tell the mother, if your birthday, on your birthday of your daughter, give her a gift of HPV vaccine. This is the gift for her on birthday. Give this one vaccine, then cost 2,000 rupees. So this is the minor thing of counseling, as you said, and we always tell them, ask them, to check them, and vaccinate. Every adolescent visit is a vaccination approach. Every adolescent visit, come for cough and cold, come for school certificate, birth certificate, anything. So this should be our motto. We have to catch them at the early stage. We are not able to go to school. We are the pediatrician. So at our we can do something. When a early child come and two children siblings are there, mother comes. I keep them talking. Okay, have you this girl? You have done it? No. So that is the way Just in between, you can do some little bit counseling, and you can ask them. It will also help them in reminding also if they miss the vaccine. Thank you very much.
Thank you.
So thank you, Dr. Satish Sharma. Thank you, Dr. Divyank Pathak, to elaborate completely about these things. And as डॉक्टर सतीश शर्मा सर जैसे मेंशन कि हमें डिजिटल रिकॉर्ड मेंटेन करना चाहिए, तो स्पेशली हमने उसी लिए अपना इम्यूनाइज विद प्राइड साइट को डेवलप किया है सर, जिसमें कि पेशेंट मतलब कम्प्लीटली अपना डिजिटल थिंग्स फ्रॉम एवरी एज में अपना सब कुछ मेंशन स्टोर कर सकते हैं अपना, और एनीवेयर दे कैन एक्सेस दिस डिजिटल साइट एंड डिजिटल रिकॉर्ड्स.
Yes.
So
Thank you.
as we are going to conclude our session, so the final question is we are going to starting from the Dr. Divyank Pathak. So as we discussed many things in the session about the catch-up vaccination, sir. So if we want to conclude in a one line and want to give a message for the parents, then what you want to tell to the parents, sir?
My message to every parent is very simple. Don't let a missing vaccine become a missed opportunity. Just one line. Don't let missing vaccine or a missed opportunity. So uh, it should not be an opportunity for a virus or a bacteria to attack. It should be your chance to give them protection if it's late. If it's not late, then obviously you have to go for it. So for catch-up vaccinations, I think this is the only thing, and rest everything. Yeah, it is an investment, and always take it like an investment, not as an expense.
Thank you so much, Dr. Divyank Pathak. And about Dr. Satish Sharma, can you, sir, please tell your views and in one line to our viewers and to the parents, sir?
Dear parents, vaccine don't stop at 5 years. Protect your teenagers today to prevent cancer and serious illnesses tomorrow. Okay. A missed vaccine adolescent is a mixed chance for lifelong protection. So check your card, catch up now and tomorrow. Okay.
Okay, thank you so much, Dr. Satish Sharma. So while concluding the program, so thank you so much for the being the part of immunization conclave, and we hope today's session is informative and valuable to spreading the awareness on catch-up vaccination uh, on the adults and bridging the immunity gap. So, and our special thanks to Dr. Divyank Pathak and the Dr. Satish Sharma for sharing their expertise today with us. And for those who are visiting this video, they can this video is available with our Immunize with Pride site. So do like, share, and spread these words, many including your friends, family, and the relatives. So we'll meet in our next session. So good care, take good care for the yourself. And thank you so much, sir. Thank you so much for this event today.
Thank you.
Thank you very much. Thank you.